Assalamualaikum warahmatullahi wabarakatuh. This is research proposal presentation from Group 11 entitled The Prevalence of Colorectal Cancer in Malaysia and the Factors Associated with It. So firstly, I'm going to introduce to you our group members, DANISH, WALDAN, NAIEM, FIRDAUS, IZZAT, HAIQAL, NURUL, AMANEI, and NADIAH, KHAIRIYAH. So for the first part of this research proposal is introduction presented by AMANEI and NADIAH, KHAIRIYAH. Colorectal cancer is cancer that occurs in the colon or rectum, which is also sometimes called as colon cancer for short. This condition can also arise from the abnormal growth of polyps, which then may turn into a cancer. Colorectal cancer, CRC, has become the third most common cancer globally and has attained large attention in many Asian countries in recent years as the incidence of CRC has quadrupled during the past decades in the region. CRC are also known to affect citizens of well-developed countries in comparison to poorly developed countries, as it is connected with the predisposition to carcinogenesis, low physical activity, high calorie and fat diet, obesity, and sedentary lifestyle.
Statistics below show that men have higher incidence of CRC compared to females, but there is no clear reason why females have lower risk for CRC. Several studies show that female hormones may have protective effects against CRC due to changes in biosynthesis and secretion.
For the second part of this research proposal, I'm going to talk about literature review. For the first theory is about risk factors. Firstly, the risk factor that we want to include is socio-economic factors. This is due to the reason that the prevalence of cases is very respective to the country's socio-economic development, which is also influencing the citizens' lifestyle. The socio-economic factors such as employment, education, and income especially are the most prominent thing that we can relate to. Secondly, the risk factor that should be included is ethnicity. This is because, according to BINTI et al., the annual incidence of CRC per 100,000 patients is about 28.8 for Chinese, which is significantly higher than that in other ethnic groups. So, the ethnic difference may suggest an etiological role of the genetic factors in colorectal cancer. For theory 2, I'm going to talk about management, which is for screening. Regular screening at the beginning of age 50 is the key to preventing colorectal cancer. The screening is important and very suggested by many health providers, and this is one of the most effective preventive measures that a person can take in order to avoid CRC. There are several tests that are used to screen for colorectal cancer, and it can be divided into two main groups, which are stool-based tests and visual structural exams. The stool-based tests include fecal immunological tests and also stool DNA tests. The screening by visual exams includes colonoscopy, CT colonography, and flexible sigmoidoscopy. Secondly, there is diagnostic test, which is significant in diagnosing and staging the colorectal cancer. The first step of diagnosis starts with assessment of medical history and physical examination of patient by doctor, as to learn about the possible risk factors such as family history. In lab, various tests are done to determine the cancer more specifically, such as blood tests, biopsy samples for gene therapy, and lastly, imaging tests such as computed tomography, ultrasounds, and others. I think that's all from me. Thank you.
Next, CRC is also occurred due to low awareness and uptake of screening. Every ethnic in Malaysia have poor awareness, especially older age groups, males, lower education, and lower income groups. Delay in medical treatment can result to possible sign of cancer. Obesity also can lead to colorectal cancer. This is because adipose tissue secrete tumor-promoting cytokines into the bloodstream, which disrupt metabolic processes, contributing to release of metagenic free oxygen radicals. A meta-analysis of 13 cohort study show increase in weight can increase risk of CRC. Staging is the most significant prognostic factor for the survival of colorectal cancer. Details on CRC staging can be obtained from various sources, and by knowing the accurate staging, we can prevent the development of colorectal cancer with the best preference of treatment. Treatment is a must for patients diagnosed with colorectal cancer. Several available treatments, either surgery, chemotherapy, and radiotherapy. A study showed that patients who had surgery alone tend to have greater risk of dying from colorectal cancer compared to patients which treated with adjuvant treatment, which include chemotherapy or radiotherapy, or both. The research objectives for this study include to determine the natural history of CRC and to discover the prevalence of CRC in Malaysia. Next, are to determine the factors associated to the prevalence of CRC, to evaluate the CRC screenings and its importance, and to establish the prevention or recommendation for lifestyle changes needed to avoid CRC. Research questions are: what is the natural history of CRC? What is the prevalence of CRC in Malaysia? What are the factors associated to the prevalence of CRC? What are the screening for CRC and its importance? And lastly, what are the prevention or recommendation for lifestyle changes needed to avoid CRC?
For data collection, we will use interviews with questionnaire via email or personally meet. Response will be kept in the computer and hard copy will be kept in a file. Quality control will be done after math. The statistical analysis that we use is multiple logistic regression. This is because of several reasons. 1. The study used cross-sectional study design. 2. Outcome of the study is categorical type. 3. This is explanatory type of study analysis. 4. Objective of the study involved in factors of study. 5. There are more than one independent variable. That is why we choose multiple logistic regression. Next, our reference population is colorectal cancer patient in Malaysia. The source population for the study is Terengganu State. Thus, all patients with colorectal cancer in Terengganu State were able to be included as participants of the study. Sample frame of study based on list of colorectal cancer patients in Hospital Sultanah Nur Zahirah HSNZ, Kuala Terengganu from 2010 to 2020. The inclusion criteria for study participants are with only two conditions. 1. The age must be above 18 years old. And 2. The participant need to have history of being diagnosed with CRC. In the other hand, the exclusion criteria for the study is the participant with missing value more than 20%, which categorized as invalid respondent. The sample size of the study is 100 participants at least to reach study power of 80%. Furthermore, for sampling method that used in study is convenience sampling, which in group of non-probability type of sampling method. It is true that a good sample is the one that representing the entire population by giving each participant an equal chance of being chosen. But for this type of study, we need a participant that willing to commit with the study, especially during COVID-19 pandemic season. If the convenience sampling method will fail to be conducted, the study will replace with snowball sampling method, which are by recruits existing study subject from previous study. We know that this will be bias risk, thus we use Cohen's kappa to measure their previous and recent answers, which will be explained by DANISH WALDAN. For data collection, we will use interviews with questionnaire via email or personally meet. Response will be kept in the computer and hard copy will be kept in a file. Quality control will be done after math. The statistical analysis that we use is multiple logistic regression. This is because of several reasons. 1. The study used cross-sectional study design. 2. Outcome of the study is categorical type. 3. This is explanatory type of study analysis. 4. Objective of the study involved in factors of study. 5. There are more than one independent variable. That is why we choose multiple logistic regression. Last, for my part of presentation is statistical flowchart. Begin with data exploring and cleaning. Next, univariable analysis by using simple logistic regression. Then we will done variable selection by using multiple logistic regression. Next is check multicollinearity and interaction. Then checking model adequacy. And lastly, interpret, conclude, and presenting the result. Thank you.
Next, for variables under study, the dependent variable is colorectal cancer, while the independent variables are race, age, gender, and sources of exposure. For outcome factor, it should be genetic factor as primary factor of colorectal cancer, in which, according to a study, Chinese race have more number of cases accounted for colorectal cancer. As for the measurement issues, it is to validate the questionnaire through tests. For the answers, it is through reliability tests by using Cohen's kappa cross-tabulation. For the ethical issues, medical record can only be retrieved if the hospital and participants permitted. Participants need to be willingly share their personal information before participating, and their personal data will not be exposed and strictly kept. The rate of the study performance will be rated by participants. Next, we move on to study flowchart. It started from participant selection to inclusion and exclusion criteria to simple random sampling, data collection, data analysis, result discussion, presentation, interpretation, and conclusion, and lastly, the write-up. For the expected results, the results are presented in tables for race, age, gender, and sources of exposure. For race, we specify it into main races in Malaysia, which are Malay, Chinese, Indian, and others. The sources of exposure will also need to be specified based on the respondents' survey answers.
Okay, next is chapter 6, Gantt chart and milestone. So this is our Gantt chart. Our study period is about 8 months. We start with completing our proposal on January 2021. And then our project ends after the presentation in conference on September 2021. We done the data collection on May 2021. On the August 2021, we complete the discussion and then submit our thesis on September 2021. Our milestone, we complete 60% of our project on July 2021, where we have done for the data collection. On September 2021, after the presentation in conference, we complete 100% of our project. Okay, so reference, this is the reference that we use, and That's all. Thank you.